Hi, welcome to our video. Today we are exploring the stages of labor and will be describing a normal vaginal birth.
In our video, we will be addressing the definition of a vaginal delivery, the first, second, and third stage of labor, and the role of the midwife and nurse in each of these stages.
A vaginal birth occurs when the mother delivers the baby through the cervix and out the vagina. Vaginal births are the most common form of childbirth, accounting for 70% of all childbirths experienced by Australian women in 2009. During the vaginal birth, a midwife will be present to deliver the baby. The midwife is a healthcare professional who works with women to provide support and advice, as well as to conduct a birth. This care involves educating the mother of preventative measures, for example, encouraging attendance at stress reduction seminars if the mother appears concerned about the delivery process, promoting a normal vaginal birth, being able to identify any complications in the mother and/or child, and knowing how to conduct emergency measures if necessary. A study was conducted regarding what childbearing women found most valuable in a midwife, and the most common ideas were the provision of support, the freedom of choice, feeling empowered to make informed decisions, and having relevant resources and information presented. Now we will discuss the 3 stages of labor.
It is important to be able to recognize the signs of going into labor so that you can prepare for the birth of your baby. Symptoms of going into labor include loose bowels, backaches, period-like cramps, a gush or trickle of water, and contractions. The first stage of labor is divided into 3 phases. The first phase is the latent stage. During this stage, the cervix dilates from 0 to 3 centimeters and it is accompanied by mild contractions that may be regularly or irregularly spaced. The second phase of labor is the active stage, which is accompanied by strong, painful contractions which tend to occur within shorter intervals as the cervix dilates from 3 to 7 or 8 centimeters. When these contractions occur, it is a signal to call the midwife or the hospital. The third and final stage of labor in the transition stage is when the cervix fully dilates to 10 centimeters. Contractions can feel much more intense, painful, and frequent as the baby's head moves down the birth canal.
For second stage of labor, full dilation means from full dilation of the cervix, which is 10 centimeters, to birth of the baby. Low latent phase is the phase often has a longer and stronger contraction and woman can go into self. It is viable in time and also called resting phase. For explosive phase, women usually push urge wires. Joint occurs because of the change in vocalization. Mothers may or may not be defecate. Pointing anions, perineum bulges, visible presenting part may present, and if no range of movement before might be present in this phase. Perineal phrases, which is a phrases presenting part remains on perineum between contraction. Widest part of presenting part move through the course of carriers. Crowning occurs where widest diameter passes through perineum and birth of head. Recognition of stage 2 include presumptive recognition, which includes urge to push, shows range of movement, often occurs at commencement of second stage, and dilation and anal cleft line, which is purple line. Definitive recognition includes vaginal examination, which can tell that cervix is fully dilated and presenting parts visible on perineum. Management and nursing role. Never leave the patient alone once she has been transferred to the delivery room. Encourage her to rest between contraction and to push with contractions. Nurse can support in psychologically, physically, position and pushing. Assessment can be educating, such as how to progress going, the well-being of mother and also the baby. Nurse can also advise or help the mother to release pain, such as talking to her and divide her concentration. Massage is also good for this stage. Important for nurse and midwives to document the change of patients and monitor the patient's blood pressure and fetal heartbeat every 5 minutes and after each contraction.
The third stage of labor, it begins immediately after the delivery of the baby and ends with complete execution of the plasma and membrane. And it has two managements. One is active management and another one is a physiological management. In the active management, it gives oxytocin with 1 minute after childbirth, then deliver plasma by controlled traction on the umbilical cord and contains pressure to the uterus. Finally, massage the uterus through the abdominal abdomen after delivery of the plasma. It usually takes 5 to 15 minutes, helps to prevent postpartum hemorrhage. In the physiological management, it usually takes up to 60 minutes. The plasma is delivered by the maternal effort. It without intervention, no oxytocin drugs, cord clamping, controlled contraction, and palpation of the uterus. The roles of nurses and midwives is to catch relaxation of the delivery of the plasma, to congratulate on delivery of baby, help mothers to deliver the plasma and membranes. After all the things done, the nurses and midwives need to check vital sign and monitor bleeding, prevent patient's infection and bleeding.
Thanks for watching.